Good morning. I'm Dr. Tanveer Janjua. I'm a board certified facial plastic surgeon, and today I want to demonstrate liposuction of the face. Liposuction of the face has to be done in a very precise fashion and in a very conservative manner. Otherwise, it can lead to irregularities and asymmetries. We will see a patient in the jowl area. She has had a facelift, but there are some remnant jowls that we want to address today, and that's what we will demonstrate. I will be marking the areas of prominence around the jowl that extends all the way almost to the oral commissure. And the goal is not to completely eliminate these, but just to soften these areas. We do not want these to be sunken. Next step is to inject with local anesthetic, using it as almost a tumescent solution before doing the limited liposuction. I am using a solution of lidocaine 1% with epinephrine, buffered with sodium bicarbonate and mixed equally with Marcaine 0.25% plain. At this point we will start the procedure, and we always want to make our stab incision for liposuction at a lower level below the mandible so it's not visible. And a small stab incision with a 15 blade usually is enough to give access. I'll turn you this way. There you go. Perfect. At any time if you feel anything, please let me know. First, we start with an 18 gauge blunt cannula, and without any suction on it, just to tunnel our way. This helps to break up any adhesion, scar tissue, and also loosen up the fat. You have to use a rolling pinch technique to make sure that you are grabbing the skin, and there's a flat area on the cannula handle which allows you to put your thumb, and that will make sure that the open port is away from the skin, and that will minimize the risk of any asymmetries. If the open port of the cannula is facing towards the skin, then the risk of sucking and removing too much skin from the dermis is higher, and then that can lead to irregularities and dimpling. We do not want that. At this point, we switch over to a 2 millimeter cannula, and still without any suction. We have to stay within the boundaries that we mark to ensure that we do not liposuction the area which is not the intended target. At this point, while I'm doing this, there's some of the fat coming out already, dripping down along with the mixed liquid. So that emphasizes the importance of breaking down the fat after tumescence. And periodically we have to feel the skin with a pinch technique to ensure fat is being removed. At this point we switch over to a 10 cc syringe, which gives plenty of suction for a small area. Aggressive suctioning using a wall suction or a liposuction machine can be very aggressive and not suitable for this area. So while maintaining hand traction, we can go gently back and forth. And at this point, we always maintain the eye on the flat area to ensure the port of suction is away from the skin. If you lose suction, you can go back up. As you can see, there is some fat already in there. How are we doing? Periodically we stop and we reassess, because the swelling you cannot reassess visually, you have to palpate, and that gives you a good idea of the amount of fat that has been removed. At this point, we have completed the liposuction in this area. On pinching the main jowl area or center, you can feel that there's not much fat there. This will be some dead space, and taping the area will be important to avoid collection of any fluid after surgery. We will now continue the same procedure on the other side. We have completed the tunneling with the 18 gauge blunt cannula, and we will move on to the 2 millimeter cannula. In this area, you obviously want to stay superficial, meaning not deep, close to the muscle layer, because the marginal mandibular nerve is very close. We move on to the suction part of the procedure. And immediately, as you can see, we have about 1 cc of fluid mixed with fat. Again, with the rolling pinch technique, you look for the results and you can tell that it is pretty much gone. Majority of the fat has disappeared. If at any area you notice any depression, you can always replace the same fat in that area to smoothen it out with a little amount. So as you can see, I replaced about 1.5 cc right in the center where it appeared to be dimpling a little bit. You do not want to dimple, and you can safely put some of the fat back. And now we have a nice jowl which is reduced but still youthful in appearance. Go to the other side. At this point, we look for symmetry on both sides. And the jowls look quite symmetric. The swelling sets in pretty fast, so we have to take that into account. And considering that we have quite a bit of symmetry, all we will use is a single 6 of prolene suture for the stab wound to close the wounds, and that will be the end of the procedure. After that, we will be placing tape on the area for pressure for up to 24 hours.